Most men don't pay much attention to their ejaculate, but it's like a secret health report. A sudden change in color, texture, or volume could be the first sign of trouble. Many brush it off, thinking it's just a random fluctuation, but the body always finds ways to communicate when something's off. Imagine seeing a pinkish hue one day and thinking, that's odd, but then forgetting about it. Weeks later, the color persists, and discomfort creeps in. What seemed trivial might be a warning. The body rarely throws signals without reason, and ignoring them could mean missing an early detection opportunity. What's considered normal? That's where things get interesting, because normal isn't as obvious as it seems. While some variations are harmless, others indicate underlying health issues. Knowing what's expected versus what's alarming is crucial, and that's exactly what the next section uncovers. What's considered normal? A healthy ejaculate has a pearly white or slightly grayish hue, a thick but fluid texture, and a volume close to a teaspoon. It starts out thick but should liquefy within 15 to 30 minutes, making it easier for sperm to travel. Any major deviation from this baseline could hint at underlying issues that shouldn't be ignored. Think of it like engine oil clean. Smooth and free-flowing means everything is running well. But if it's lumpy, discolored, or too thin, something might be off. The same applies here. Clumps, excessive stickiness, or an unusual smell could signal an infection, dehydration, or even hormonal imbalance. But what if one day your semen takes on a strange hue? That's where things get more concerning. Changes in color: yellow, pink, brown can mean anything from mild irritation to an infection, or even something more serious. Let's break it down. Semen color can reveal more than most men realize. A yellow or greenish tint might indicate an infection, especially if there's an unusual smell. A pink or reddish hue suggests the presence of blood, often caused by inflammation, irritation, or minor vessel rupture. While occasional discoloration might not be alarming, persistent changes deserve attention. Brownish semen is a bigger red flag. It often means old blood, possibly from prostate or seminal vesicle irritation. If this happens once, it could be a minor issue, but if it keeps occurring, it might indicate something more serious. Ignoring it could mean letting an underlying condition go undetected until symptoms worsen. If your semen suddenly changes color, don't panic, but don't ignore it either. Staying hydrated, reducing stress, and avoiding excessive alcohol can help in some cases. But when changes persist, a doctor's visit is the best move. If you are enjoying the video, please consider helping by clicking the like button and subscribing. It means a lot and motivates us to bring more quality content for you. Now let's continue. Texture and clots. Why your ejaculate feels thicker or clumpier than normal. Semen should have a smooth, gel-like consistency, but when it turns clumpy or overly thick, something might be off. Dehydration can play a role, making the fluid more concentrated, but infections or prostate congestion could also be at fault. If the texture shifts dramatically and stays that way, it's worth investigating. Imagine pouring honey instead of water-thicker fluid means something is slowing things down. Clots or jelly-like bits might point to inflammation in the prostate, making it harder for the glands to function properly. On the flip side, if semen is too watery, it can mean low sperm count or reduced seminal fluid production. A consistent change in texture isn't just an odd quirk. It could indicate a deeper issue. Drinking more water and improving your diet can help. But if things don't return to normal, medical advice is crucial. And if you've noticed changes in volume or force, that might tell an even bigger story about prostate health. A sudden drop in ejaculate volume isn't just an age-related issue, it could be a sign of prostate trouble. When the prostate and seminal vesicles aren't producing enough fluid, ejaculation weakens. This might be due to inflammation, hormonal imbalances, or even a blocked duct that disrupts normal function. Think of it like a garden hose. If water pressure drops, there's usually a kink or blockage. Weak ejaculation can stem from prostate enlargement, pelvic floor weakness, or low testosterone levels. If semen barely travels or dribbles out, It's a sign that the system isn't firing on all cylinders. Strengthening pelvic muscles with exercises like Kegels and staying physically active can improve function. But if the issue persists, testing hormone levels and checking for prostate health problems is essential. And when blood shows up in semen, it's time to take things even more seriously. Seeing blood in semen can be unsettling, but most men brush it off, hoping it's a one-time thing. While occasional traces might result from minor irritation, repeated occurrences signal a deeper problem. Chronic prostatitis, infections, or even prostate cancer could be behind it. Making early detection crucial. Picture a warning light flashing on your dashboard. Ignoring it won't make the problem disappear. Blood in semen, especially if paired with discomfort or pain, suggests something isn't right. It might be an inflamed prostate, a ruptured blood vessel, or even a hidden infection that needs medical attention. Don't gamble with your health. If you notice persistent blood in your ejaculate, schedule a checkup to rule out serious conditions. Addressing it early can prevent complications and keep your sexual health in check. And if you're wondering what else your semen might be, telling you, there's even more to uncover. Now that you know what your semen reveals about your prostate, what will you do with this knowledge? Will you ignore the signs, hoping they go away, or take control of your health before problems escalate? Your body speaks in signals. Understanding them can be the key to long-term sexual health. Have you ever noticed changes in your ejaculate and wondered what they meant? If so, now is the perfect time to start paying attention. Small adjustments like staying hydrated, exercising, and getting regular checkups can make a difference. What step will you take today to protect your prostate health? If you found this helpful, subscribe to the channel and turn on notifications so you never miss essential health insights. Also, watch this video that's appearing on the screen can help you improve your sexual health. Click on it